Welcome to our detailed exploration of acute pancreatitis. I am Paramita Chatterjee and today we will uncover the critical aspects of the painful and potentially dangerous condition which is called pancreatitis. Before going to the pancreatitis, we know about the anatomy of the pancreas. Pancreas is an important organ in the digestive system. And it is located in the upper abdomen directly behind the stomach and next to the small intestine. In most adults, it is between 6 to 10 inches long and 2 inches wide. The pancreas is comprised of network of tubes or pancreatic duct. These tubes or duct releases pancreatic enzymes or digestive juices in the duodenum, which is the part of small intestine. Anatomically, pancreas is divided into the head, neck, body and the tail. Pancreas has two functions. One is endocrine and another one is exocrine function. What is endocrine function? Endocrine function is to produce chemicals or hormones that regulate blood sugar such as insulin, and its exocrine function is release enzymes that help to digest food. Endocrine function is releasing the hormones such as insulin, and exocrine function of pancreas is releases the digestive pancreatic juices. What happened? The exocrine gland secrete the digestive pancreatic juices, and these pancreatic juices combine with bile and also intestinal secretion. And these bile and intestinal secretions and pancreatic juices further digest the food. First, food enter to the mouth, then arrive to the stomach. In the stomach, food is partially digested. In the stomach, food is partially digested, and these partially digested food are completely digested in the intestine with the help of digestive pancreatic juice, which is secreted from the exocrine gland of the pancreas. So what are the pancreatic enzymes? First one is amylase. This enzyme digests carbohydrate and breaking down their starches into the sugar for energy in the body. And second one is the lipase. Lipase break down fat with the help of bile, and the protease, it's break down the proteins and protects your body from bacteria and yeast that may found in the intestine. And last one is trypsin and chymotrypsin. These enzymes are also involved in the digestion of protein. So what happened in the duodenum or small intestinal part? The digestive enzymes or pancreatic juices, when these digestive enzymes or pancreatic secretory juices are stay in the pancreas, they are protected by a wrapped or covering protective layer. They are covered or wrapped in a protective layer when they are in the pancreas. When digestive enzymes are in the pancreas, they are inactive form and they are so much powerful, it becomes wrapped in a layer when it is in the pancreas, and its name is zymogens. When zymogens released from the pancreas and arrived in the duodenum, these zymogens get activated and the protective layer are removed. These enzymes, zymogens, when enter in the ampulla of Vater, this time these zymogens protective layers are removed and it's become active form. This is the normal phenomena. When the zymogens in the pancreas, this is inactive form and covered by a wrapped or protective layer. When it's in the duodenum, it becomes active form and the protective layers is removed and it chop out the carbohydrate, protein and fat. This is a normal phenomena. But if the zymogens in any circumstances or any condition, in any abnormal situations, if zymogens get activated in the pancreas, then what happened? Here in normal phenomena, zymogens are inactive form and activated in the duodenum. If any abnormal situation such as gallbladder in the stone, any injury happened or any mumps virus present or any autoimmune disease, in that case zymogens activated in the pancreas. If it's activated in the pancreas, the digestive juices which is most powerful or active, if the protective layers is removed, they get activated and they auto digest the pancreatic tissue. They digest the pancreatic tissue. And what happened? Injury to the pancreatic cell and also pain or edema, necrosis, hemorrhage, that type of problem happened here. So this is the anatomy and physiology of pancreas. Then definition. What is pancreatitis? Acute pancreatitis is a sudden inflammation of the pancreas, a vital organ located behind your stomach, and this condition occurs when pancreatic enzymes which help to digest the food, when this is a normal phenomena, the pancreatic enzymes digest food, helps to digest the food, but in abnormal situation, in pancreatitis, this is the abnormal situation. In pancreatitis, these pancreatic enzymes start digesting the pancreas itself. So this leads to severe pain and cause significant health complication. So let's start with the definition. Acute pancreatitis is an acute inflammation of the pancreas. Spillage of pancreatic enzymes into surrounding pancreatic tissue causes autodigestion and severe pain and damage. Then etiology. What happened? What are the cause behind it? What causes this to happen? The most common causes include gallstone or chronic alcohol consumption. And other factors can contribute such as certain medications, high triglyceride level or even abdominal injury. So what are the causes responsible for pancreatitis? First one is I for idiopathic, G for gallstone, E for ethanol, T for trauma, S for steroid, M for mumps, A for autoimmune, S for scorpion stings, and H for hypercalcemia and hypertriglyceridemia, and E for endoscopic retrograde cholangiopancreatography, and D for drugs. So if we remember the causes of or etiology of pancreatitis, we should remember the term eye gate smashed. I for idiopathic and gate for gallstone ethanol trauma, and smashed for steroid, mumps, autoimmune, S for scorpion stings, H for hypercalcemia and hypertriglyceridemia, E for endoscopic retrograde cholangiopancreatography, and D for drugs. So we discuss one by one. First one is idiopathic, and the second one is gallstone. When the inflammation of pancreas occurs, we may call pancreatitis. Pancreas has two ductal systems. One is ductal cell epithelium. This is the ductal cell epithelium, and this is the tiny little duct which is called acinar cell. This is most important cell in the pancreas. Acinar cell and ductal cell epithelium. Ductal cell epithelium makes bicarbonate rich fluid. Ductal cell epithelium makes bicarbonate rich fluid, and the acinar cell makes digestive juices, which is lipase, amylase and protease. So when the normally in acinar cells, a granules or zymogens stay in the inactive form. In acinar cell, zymogens stay in inactive form. In the zymogens, all the digestive enzymes lipase, amylase and protease stay in inactive form. When these enzymes from the acinar cells through the duct arrived in the duodenum, during that time it activated, and to be able to chop up lipid, protein and fat in a diet. When these are stored in the acinar cell, the zymogens don't need to be activated. But when the zymogens in the duodenum, it get activated. Then what happened in the gallstone? In abnormal situation, how does pancreatitis happen? If we block the hepatopancreatic ampulla, if we have obstruction in the pancreatic duct, all the secretions build up in the blockage, and they can cause start pressure rising and alter the movement of enzyme secretion. If the gallstone stuck into the hepatopancreatic ampulla, so all the digestive enzymes which is out from the pancreatic acinar cells or ductal epithelial cells, stored in the blockage, and it create pressures. So all the back pressure start to destroy natural movement of the digestive enzymes, which is called zymogens. And these zymogens, which is normally not activated in the pancreas, during abnormal situations it activated in the pancreas. And activations of the digestive enzymes digest all the pancreatic tissue, and auto digestion happened. So it's a etiological factor for gallstone. Then comes to the second another cause, ethanol or alcohol. If the patient is alcoholic, if patient take daily alcohol, it directly stimulates the acinar cells. Alcohol directly stimulates the acinar cells and zymogens released. And same process, the zymogens get activated in the pancreas and it auto digests the pancreatic tissue. And another one is alcohol acts on the ductal cell, and ductal cells make bicarbonate rich fluid. In abnormal situation, if patient takes much more alcohol, then what happen? This bicarbonate rich fluid becomes thick, and thick bicarbonate mucus secretions obstruct the normal movement of zymogens, and same result, zymogens get activated in the pancreas and it auto digests the pancreatic tissue. If trauma, then another etiological factor is trauma. What happened in trauma? In trauma, it directly injured the acinar cell. If acinar cell is injured, then zymogens released, and if zymogens is released in the pancreas, it destroys the pancreatic tissue. Then another one is steroid. Steroid also activate the ductal cell, and again the bicarbonate rich fluid obstruct the normal movement of zymogens, and zymogens get activated and it digests the pancreatic tissue, auto digestion occur. Then mumps. What happened in mumps? Mumps are another one which is also destroy the acinar cells and alter the movement of zymogens. And then another one is scorpion stings. Scorpion stings also destroy the acinar cells and alter the movement of zymogens, and zymogens get activated and autodigestion happened. Then hypercalcemia. If in blood, hypercalcemia means calcium is excess in blood, and if calcium is excess in blood, calcium activate the protease, and protease helps to digest the pancreatic tissue. And in hypertriglyceridemia, what happened? Triglyceride level is excess in blood. If triglyceride level excess in blood, it becomes stuck, it crosses the GI tract and it stuck into the blood capillaries, and the blood capillaries are blocked. Then which capillaries supplied the blood in the pancreas, these capillaries are blocked. If this capillaries is blocked, then pancreas, ischemic, necrosis and death of the pancreatic cells. And another one is endoscopic retrograde cholangiopancreatography. What happened in ERCP? ERCP done to identify the gallstone and remove. This helps to remove the gallstone. During the removal or identification or diagnosing purpose, if it used in the patient, then it also injured the acinar cells. If acinar cells are injured, then alter the movement of zymogens and pancreatic juices or pancreatic digestive enzymes are activated and it auto digests the pancreatic tissue. And same is drugs or medications, furosemide or HIV drug, it also destroy the acinar cells and alter the movement of zymogens, and same result, if zymogens movement is altered, then the digestive enzymes are get activated, and it also digests the pancreatic tissue. So then another comes to the pathophysiology. Pathophysiology of acute pancreatitis. First initiating event, maybe gallstone, maybe hypertriglyceridemia, maybe injury to the acinar cells, maybe mumps, maybe a corticosteroid use, or idiopathic cause, another precipitating event. Then it leads to injury to the acinar cells. If acinar cells is injured, then it impairs the release of zymogens. If zymogens release is impaired, then premature activations of the enzymes, digestive enzymes in the pancreas, and premature activations of the enzymes helps to autodigestion of the pancreatic tissue. Here is the picture. Again, this picture shows how the normal mechanism, enzymes release from the pancreas to the duodenum and helps to digest the or chop up the fat, protein or carbohydrate, which food comes to from the stomach, partially digested food, and here the food is completely digested. And in pancreatitis, what happened? Enzymes not arrived in the duodenum, enzymes stay in the pancreas. Normally enzymes arrived in the pancreas and get activated, and in abnormal situation, pancreatitis, enzymes not arrived in the duodenum, enzymes get activated in the pancreas or injured the acinar cells. If acinar cells is injured, then digestive enzymes or zymogens get activated. If zymogens get activated, then it is a strong, powerful enzymes, which is lipase, protease and amylase. These enzymes digest the pancreatic tissue. So last of result, inflamed pancreas. This is the normal situation. This is the abnormal situation in pancreatitis. Then sign and symptom of pancreatitis. Sign and symptom of pancreatitis. So how can you recognize acute pancreatitis? The hallmark symptom is severe abdominal pain. Severe abdominal pain is the hallmark symptom that often radiates to the back, and this pain can be so intense that it requires immediate medical attention, and other symptoms may include nausea, vomiting, fever or rapid pulse. We discuss about the signs and symptoms. Here the first one is abdominal pain, and then fever, pale skin, dry mouth, rapid pulse, swelling, diarrhea, cyanosis, nausea and back pain. So first one is abdominal pain. Abdominal pain, certain constant pain radiates to the back, and certain position makes the pain worst, or certain position makes the pain just lying down back. Lying down back causes pain worst, or lean forward causes the pain much better. Then this pancreas abdominal pain happen, and inflammation of the pancreas causes irritation to the nearby structure. If pancreas is inflamed, it irritates the nearby structure, compressing the duodenum or stomach. It leads to abdominal distension, and also it leads to nausea or vomiting. So inflammation of the pancreas leads to abdominal distension and also leads to nausea and vomiting due to irritation of the stomach and duodenum, and often it's affect the motility of small intestine. So less bowel sound we may heard less bowel sound or bowel obstruction. If I have gallstone, bile can push through common bile duct and bilirubin goes to the bloodstream, then a jaundice may be occurred in the pancreatitis. And another hallmark sign is Cullen signs and Gray Turner signs. Cullen signs is a hemorrhagic discoloration of the umbilical area due to the intraperitoneal hemorrhage. Intraperitoneal hemorrhage is the main cause for the Cullen signs, and it's a hemorrhagic discoloration of the umbilical region. And one of the more frequent causes is acute hemorrhagic pancreatitis. And the Gray Turner sign is a discoloration of the left flank associated with acute hemorrhagic pancreatitis. So this also a hemorrhagic hallmark sign. Then others are fever and pale skin, dry mouth, and also rapid pulse and swelling, diarrhea, cyanosis, nausea and back pain. So abdominal pain is the predominant manifestations of acute pancreatitis. This pain is due to the distension of the pancreas or peritoneal irritation or obstruction of the biliary tract. Biliary tract obstruction may be another cause, or distensions of the pancreas or peritoneal irritation. These three are responsible for abdominal pain. This pain is usually located in the left upper quadrant. Left upper quadrant we may feel the pancreatitis pain, and it described as a severe, deep, piercing, continuous and steady pain. This pain is aggravated by eating. It frequently has its onset when the patient is recumbent. If it is not relieved by vomiting or may be accompanied by flushing, cyanosis or dyspnea, the patient may assume various positions involving flexion of the spine in an attempt to relieve the severe pain. And also bowel sound may be decreased or absent. Paralytic ileus may be occur and causes marked abdominal distensions. The lungs are also frequently involved with crackles, and intravascular damage for circulating trypsin may cause the area of cyanosis or greenish to yellow brown discoloration of the abdominal wall. And shock may occur because of hemorrhage into the pancreas. And also the shock may occur, also the hypovolemia, or hypovolemia may result from the shift of fluid into the retroperitoneal space or massive fluid shifting. So these are all the sign and symptoms of the pancreatitis, because trypsin activations of the pancreatic enzymes leads to injury to the pancreatic cells, and activations of the pancreatic enzymes, which is trypsin, elastase or lipase or another one, these are all causes necrosis, hemorrhage or edema, vascular permeability, shock. These are all the effect of autodigestive effects of pancreatic enzymes. So these are the main cause, autodigestive effects of pancreatic enzymes. This leads to abdominal pain, fever, pale skin, dry mouth, rapid pulse, swelling, diarrhea, cyanosis, nausea, back pain, Cullen sign, Gray Turner signs, and also shock. So thank you for joining me today. Stay informed, stay healthy, and remember to subscribe my channel. So thank you again.